Hi, I'm Fred.
And I am John.
And this is Fred and John Talks.
So women, listen up. Dr. John has some message for you about your favorite topic, menopause. I'm sure that's your favorite friend, menopause, those of you out there who have suffered from menopause. There are a lot of things you can do that are positive and will help you with menopause. Exercise is one of them. Some of my patients used to say that if they yelled at their husband, that was helpful as well. There are triggers that will set menopause off and your symptoms and make them worse. Avoid caffeine, avoid coffee. Meditate will sometimes help you avoid symptoms. Take estrogen. There are alternative medications like Zoloft, gabapentin, estrogen. But you know, many of you suffer from anxiety, depression, and other symptoms of menopause. And it's probably my wife told me that the worst symptoms she ever had, apart from the internal heat that she experienced, was sleeplessness and irritability, the inability to have good night's sleep. Now, one of the problems I hear from patients is I don't want to take estrogen because it's going to give me breast cancer. Well, the good news is that about 5 to 10% of breast cancers are heredity. That means that 90% of breast cancer is a contribution of other factors, environmental factors, things you're exposed to like xenoestrogens, which are plastics, phthalates, BPA, PCBs, parabens in your makeup. All these things are actually harmful to you, as well as vinyl flooring and some of the plastics. In fact, plastics are not helpful at all. They're full of phthalates. So xenoestrogen, Z-E-N-O, can combine from the environment with estrogen in your body, or if your doctor is giving you estrogen, then you have a double whammy of too much estrogen. And maybe that can be related to breast cancer. So think about these environmental toxins and trying to get environmental things out of your home, out of your cleansing, out of your makeups, and out of products that you use where you have your hands in soaps or products that have phthalates in them. There are protective effects of estrogen. Estrogen helps reduce heart disease. It helps reduce aging of blood vessels and arteries called atherosclerosis. It may help in some women and some family histories reduce their risk of stroke. It helps improve mood so that you don't yell at your husband or your boyfriend. And obviously it helps hot flashes and it may help sleep. Probably one of the most important ways it helps you is by improving your bone structure and helping you keep calcium in bone and help prevent osteoporosis. That was one of the big factors in treating my patients, is trying to get them to stay on estrogen long enough in their late 50s, maybe even in the early 60s. A lot of experts say you should be on estrogen right up to 61 or 62. So preventing fractures and osteoporosis is a major reason to be taking estrogen. Now, recently, I never use this in my practice, but recently I've been reading about alternative forms of therapy and care that maybe needed to be added to your anti-anxiety or to your depression drug or to visits you make with your gynecologist about estrogen. And some of you even take progesterone, by the way, for menopause. But adjunctive things you might be thinking about or look into are cognitive behavioral therapy, cannabis products, and hypnosis. Now, I personally never really sent a patient for any of these therapies, but I have seen articles popping up and suggestions about using these types of therapies. And you know what? You are lucky because Fred is a psychologist and behavioral psychologist and clinical psychologist, and he has some words for you about cognitive behavioral therapy.
Hi, I want to add my 2 cents over here because I did some research. And I've got 3 things to share with you. We'll go from the least effective to the most effective. And They each begin with the same letter, C. So it's the three C's today. CBD oil. John had mentioned cannabinoids. There's a lot of anecdotal evidence that CBD oil, which is derived from the cannabis plant, can be effective in alleviating symptoms of menopause. But in my research, there's no scientific evidence to show this, and they've done some studies, and they keep coming out as inconclusive. So I would recommend to my patients that they don't go to that as a first choice treatment. Moving on to CBT, which stands for Cognitive Behavioral Therapy. To put it simply, CBT is built on the premise that it's not events or feelings that drive us. It's how we think about those events and those feelings and those experiences that drives us to feel a certain way and behave in a certain way to adjust. So the old saying about the power of positive thinking comes into play here. One thing that's very popular in CBT is that they point out to people that because of their extremely negative interpretations of experiences and events, there's a great tendency to catastrophize, to make something this size into something this size, like it's catastrophic. As far as menopause, though, again, there's evidence that it isn't that helpful for relieving most symptoms. It can be very helpful for reducing the anxiety about the symptoms. That's the second thing. And the last thing is really good news because it has to do with another C, clinical hypnosis. Now, I want to tell briefly my story, and it just goes like this. I got clinical hypnosis 4 months ago to help stop smoking, and I haven't smoked in 4 months. And I talked to my therapist, and she says that she uses clinical hypnosis for a wide range of things, including menopause. And that's backed by the research. This research that was done in 2024, just a year ago, shows that clinical hypnosis has a 60% success rate in reducing symptoms of menopause. So there it is. That's just a brief addition. But, on a final note, in my 33 years of being a counselor, a lot of people respond to the word hypnosis with fear. And it's based on what they see on TV or in movies, which is just entertainment. There's no such thing as saying, putting your hand over a person's head and you're now hypnotized, and then quack like a duck. That's just entertainment. But clinical hypnosis is effective for a wide variety of things. I don't even think about cigarettes anymore. So, for those of you with menopause, clinical hypnosis can be very helpful.
So this is John again to make a few concluding remarks about menopause for women out there. Unfortunately, the bad news again is that most of you are going to have some form of menopausal symptoms, sometimes as early as age 35, and it may range for 15, 20 years. I've had some patients who've gone through menopausal symptoms and harassment for up to 20 years. But at some point in your life, you may experience these kinds of feelings of hot flashes, internal heat, and sleeplessness and other symptoms. I just think that don't be afraid to take estrogen, because estrogen is only proven to be a problem in those women who have the 10%, up to 10% chance of hereditary breast cancer. And those women should not be on estrogen. But if you have a negative family history, I don't think I'd be afraid of estrogen. And then medications like Zoloft and gabapentin and drugs that can lessen your anxiety and fear about menopause and give you better rest also are very, very helpful. And then I hope you'll pay attention to what Fred said about thinking about cognitive behavioral therapy or talking to your GP or gynecologist about any kind of counseling that could make your symptoms more bearable and help your family life. I wouldn't be a big fan of cannabis. Fred commented on that briefly. There's no scientific evidence that supports that. And then I think hypnosis, clinical hypnosis, if you have availability of that type of therapy, give it a try. I mean, it's something that may be worthwhile. So that's our message today for women who've listened up. I hope these ideas and concepts and thoughts about menopause will cheer you up and you'll feel better. Thank you.